Hello, everyone. Today is Monday, January 26th, 2026, and you have joined Ask a Care Navigator, Mondays with Maureen. Hello, everyone. My name is Maureen Williams, and I'm the Director of Care Navigation here at Four Seasons, the care you trust. And we try to create this space on most Mondays to talk about issues associated with living well and aging well, and perhaps how Four Seasons may be of service. If you have any questions or comments, you can drop them into the comments box from whichever platform you're viewing, or please call us at 866-466-9734, or please go to our website, which is fourseasonscare.org. And please spell out the number 4, FOURSEASONSCARE.org. And Four Seasons is very grateful to the Van Winkle Law Firm for serving as the title sponsor for this program, Ask a Care Navigator, Mondays with Maureen. The Van Winkle Law Firm is one of the most respected and established law firms in North Carolina, providing exceptional legal representation to individuals, families, and businesses in personal, business, commercial, and estate planning matters. If you would like more information or to schedule a consultation, please go to www.vwlawfirm.com and someone will be happy to assist you. And we are just so grateful. Well, in the month of January, I've been talking about where you're going to live. We talked about continuing care retirement communities, or CCRCs. Last week, we talked about assisted living and memory care communities. So today I thought I'd talk to you a little bit about the costs of long-term care, specifically in nursing communities, aka nursing homes. So I'm going to share with you some data. I'm going to just talk with you data about the costs of long-term care. First, I'll talk nationally just a little bit. So nursing home costs vary widely across the United States, and particularly by location and room type. Generally, it ranges from about $9,000 to $11,000 a month per month for a private room, but it could be from under $6,000 per month for a private room and up to over $30,000 a month for a private room. So it really varies pretty widely across the country. And semi-private rooms are just slightly less than that price for the private rooms. All in all, though, the costs for a nursing home or nursing community level of care are usually around $100,000 per year. Just think of that ballpark number. Some places do have lower rates. I get that. And there are lower rates and costs for veterans and those under Medicaid. And this all requires very careful budget preparation. So that's why I'm sharing this with you now. Let's talk a little bit about North Carolina for a moment. Nursing home care in North Carolina typically ranges from about $7,300 per month to over $10,000 per month. So averaging about $7,300 per month here in North Carolina to over $10,000 per month in North Carolina. Here in Western North Carolina, it's more toward the $10,000 per month. Usually median costs around $8,000 to $9,000 a month for a semi-private room as well. So it's just slightly less. Of course, costs vary widely by location. They're higher in Raleigh and Charlotte, of course, but interestingly also in Hickory. And they're much lower in Rocky Mount and other rural areas across the country, but the costs are still significant. They vary based on whether you want a private or semi-private room, of course. Many residents in North Carolina, given that the annual costs exceed generally over $100,000, many residents rely on Medicaid in the state of North Carolina for nursing home care. Now, let's go back to the nation in a moment. The average costs for semi-private room across the nation around $9,000 to $9,800 plus per month. So if you annualize that, that's at least $108,000 a year. This is expensive. Private rooms nationally around $10,000 to $11,300 and up per month. Again, the minimum there is about $120,000 a year annually. This is expensive care. Please plan your budgets carefully now. Let me give you another example for North Carolina now. We know that as of early 2024, semi-private rooms in North Carolina averaged $8,365 a month. Private rooms in North Carolina, as of early 2024, averaged around $9,125 per month. That was in 2024 across the state. And believe me, in Western North Carolina, it's pretty much over $10,000 a month. You hear these numbers? I'm hoping it's helping you, not just to terrify you, but to start thinking of how you can plan carefully. As I mentioned, there are various regional differences here in the state of North Carolina. Now, the key factors influencing cost anywhere in the country, there are about 4 factors. The first one is location. Costs are much, much higher in urban areas and states with high costs of living, such as Alaska and New York. And they're lower in states like Texas or Missouri. So think about location by state and even within regions by state. And I'm going to give you some tools here to check on that. It also varies by room type. Private rooms always consistently exceed the costs of semi-private rooms. While semi-private rooms may be cheaper, they're still expensive. There are level of care costs also associated with living in some nursing homes and nursing communities, depending upon the intensity of skilled nursing care that might be needed or skilled medical services that might be needed. If you need to live in a very special facility based on your medical needs, such as having a ventilator, these costs are going to be higher. And then you need to look for extra fees. Many times there are one-time fees for admission or assessment into the community, and sometimes there are ongoing monthly level of care costs or charges. There might be additional costs for physical therapy or grooming. Just look at those contracts carefully. Now that I may have terrified you for what all of this costs, how do you pay for it? Well, there are about 4 or 5 ways to pay for nursing home care. First of all, there's private pay, where you're using your own private funds, your own private savings. This can quickly deplete depending upon how much you need to spend and what your assets are. The primary payer for many individuals in many states is Medicaid, once those assets are spent down. And Medicaid only covers costs for those with low income and low assets. Think of this carefully. There's also long-term care insurance if you have it. Policies can help cover the costs or certainly reduce reliance on your own private savings. There are some beautiful policies out there that pay 100%, but those are old policies. For those of you of the sandwich generation, you probably may not be eligible for those policies, or you may have to self-fund some of your long-term care. There are veterans benefits, VA benefits. Some veterans can receive subsidized care in state-run facilities, but that doesn't mean they're free. The costs are not entirely free. For example, there's the North Carolina State Veterans Home right here locally in Black Mountain, and they will provide long-term care and work together with your private fees, and the costs are greatly reduced per day, but they're not free. So think about that. And then many people think, well, Medicare will just cover my nursing home care. And the answer is no, not for long-term care. Medicare only will cover short-term skilled nursing care up to 100 days after a qualifying hospital stay. There are significant copays at points along the continuum there too, if you don't have supplemental insurance. So Medicare is not a long-term payment option for long-term care. Hear me clearly. It's short-term. So what should you do? What should your next steps be? There's a lot. If you anticipate needing or your loved one needing to dip into Medicaid, to apply for Medicaid, I urge you now, please consult with an elder law attorney. That is their specialty. It's worth the money you might need to pay. They may be able to help you with your Medicaid planning and protect certain assets. And I don't even pretend to provide or understand it all because that's not my specialty. But I do know those for whom that is their specialty. And elder law attorneys, not estate planning attorneys, although they're great with this, but we all know that the people who are qualified to really help with Medicaid and Medicaid planning and protection of assets in these cases, those are elder law attorneys. You also might want to use certain online tools to help find state-specified data. And I'm hoping I can share something with you here on the screen. Let's try this, okay? There we go. And I'm hoping that you're seeing a little slide that I've put up here of the costs of long-term care. First of all, there's a website called www.medicaidplanningassistance.org. Medicaidplanningassistance.org. This is a very helpful tool. I've been working with it today. You can see private room and semi-private room costs per day and per year in each state by region. And the estimates that are being placed out there right now are for 2026. So MedicaidPlanningAssistance.org. It will tell you the cost of a private room per day and a semi-private room per day. It'll tell you the annual cost of a private room per day and the annual cost of a semi-private room per day by state and by region in each state. And as you look at that, you'll see how the costs really vary widely in each state. Another tool is Medicare.gov. If you want to know what nursing communities might be available in your area, go to Medicare.gov, then click the hyperlink at the top for providers and services, and then it'll pop up a separate menu, and to your left, you'll see that you can click a hyperlink to find care providers. In there, you can put in your state, your city, your zip code, and you can start looking at what nursing homes are available, what their star ratings are, what their quality ratings are, and it's very, very helpful. Another tool might be to work with an aging, or an asset to you might be to work with an aging life care professional, such as Four Seasons, someone like me, who might be able to help guide you through what your options are in each, where we live here in Western North Carolina. So that might be something you might want to consider. But there are aging life care professionals like me and my team here at Four Seasons Care Navigation all across the country. And if you're not local and you want to know who might be able to help you, who's like me, just send us a message and I'll be glad to connect you with people in your area. But aging life care professionals or Four Seasons Care Navigation, we're very in tune and in communication with the nursing communities in our area. And we would be happy, it would be a privilege to help guide you through that process. Okay, so there are lots more tools out there, but I wanted to share with you the Medicare.gov, the Medicaid Planning Assistance, .org, and certainly that Four Seasons Care Navigation can be assistance to you in this area. That's a lot of information. You need to plan now. You need to think what might happen to you. You never know what will happen. Make your plans now to live well and to age well. And what are your goals? Are your goals to live at home? Most people are. Well, what does that cost? For instance, the average home health aid costs in North Carolina are about $4,600 plus monthly. So what I thought I'd do is next week, February 2nd, we're going to unpack that. We're going to unpack what it costs to have in-home care, how you access it, and how to make plans for this now, and how to pay for it as well. So this is a lot of information, but start planning now. I appreciate the comments that some of you have sent. Just things you hadn't thought about, but start planning now at any age. At least have some conversations as to what would you want to have happen to you should you be incapacitated or disabled for the rest of your life. I don't wish that on anyone, but what does that look like? Or what does it look like for when you retire or as you age well into retirement? What does that look like? Make your plans now. So join me next Monday, February the 2nd, for another episode. We're going to talk about the in-home care pieces. And if you have any questions or comments, please call us at 866-466-9734 or go to our website, which is fourseasonscare.org. Thank you for joining today from wherever you are, and I hope you have a wonderful day. Thank you.